everyone. Today we'll be discussing the revised Jones criteria that is used for the diagnosis of rheumatic fever. So basically, what is rheumatic fever? This is an autoimmune inflammatory process that develops as a sequela of streptococcal infection. Acute rheumatic fever is diagnosed using the clinical and lab findings of the revised Jones criteria. So there is the presence of either two major criteria or one major and two minor criteria, along with evidence of an antecedent streptococcal infection, confirm a diagnosis of acute rheumatic fever. The infection often precedes the presentation of rheumatic fever by 2 to 6 weeks. Streptococcal antibody tests such as the antistreptolysin or titer are the most reliable lab evidence of prior infection. So major Jones criteria for diagnosis of acute rheumatic fever include polyarthritis, carditis, Coria, erythema marginatum, and subcutaneous nodules. So polyarthritis is common. It's swelling with limited motion of joints, and the joints are tender and they're erythematous. It is migratory, usually involves large joints, but rarely small or unusual joints such as the vertebra can also be affected. Carditis, this is also a common major criteria. So the spine carditis valve may be affected the pericardium, myocardium. So they may present with tachycardia that is greater than explained by fever. They may be a new murmur of mitral or aortic insufficiency. Carry comes with diastolic murmur and heart failure are some presentations of carditis. Then Coria, which is synonyms Coria, it is uncommon. It manifests long after infection has resolved and it's more common in females. Antineuronal antibody is positive. Then erythema marginatum, this is also uncommon. This presents with pink macules on the trunk and proximal extremities, evolving to serpiginous border with central clearing. Evanescent, elicited by application of local heat, and it's non-pruritic. Then subcutaneous nodules, these are also uncommon. They're associated with repeated episodes and severe carditis. They're located over extensor surfaces of elbows, knees, knuckles, and ankles, or scalp and spine. They are firm and non-tender. And minor criteria include fever, temperatures of 101 degrees to 102 degrees Fahrenheit or 38.2 degrees to 38.9 degrees Celsius, arthralgias, previous rheumatic fever, leukocytosis, elevated ESR or CRP, and prolonged PR interval. So for diagnosis, we mentioned that one major and two minor criteria or two major criteria with evidence of recent group F streptococcal infection. So arthritis, this is the most common major manifestation. It usually involves large joints and is migratory. Arthralgia cannot be used as a minor manifestation if arthritis is used as a major manifestation, okay? Carditis, this occurs in about 50% of patients, presents with tachycardia, a new murmur, mitral or aortic regurgitation, pericarditis, cardiomegaly, and signs of heart failure and evidence of carditis. Then erythema marginatum, this is a serpiginous, non-pruritic, and evanescent rash, is uncommon. It occurs on the trunk and is brought out by warmth. Subcutaneous nodules, these are seen predominantly with chronic or recurrent disease. They are firm, painless, non-pruritic mobile nodules found on the extensor surfaces of large and small joints, the scalp and the spine. These are the nodules they're talking about. Coria, which is synonyms Coria or St. Peter's germs. This consists of neurologic and psychiatric signs. It also is uncommon and often presents long after the infection. So basically, sydenham chorea is a rare neurological disorder that is characterized by sudden onset chorea, usually in childhood. And chorea is defined as random appearing, continuous, which is basically while awake, involuntary movements, which can affect the entire body. This often includes the face and tongue. Symptoms in arms and legs are often worse on one side of the body. So if you want to remember a mnemonic, we can use think Jones piece, okay? So when we say Jones, let's talk about the major criteria and piece, refer to the minor criteria. So J is for joints, then the heart, that's for heart, N for nodules, E for erythema marginatum, and S for pseudonyms Coria. Then P is under the minor criteria. P is for previous rheumatic fever, A is for ECG with PR prolongation, A is for arthralgia, C is for CRP and ESR elevation, and E is for elevated temperature. So as we already mentioned, diagnosis of rheumatic heart disease is made with a history of recent streptococcal infection and either the presence of two major criteria or one major with two minor criteria. This is basically another mnemonic. So that's all about revised chance criteria. If you like the video, please like, subscribe, and comment. Thank you.